Hi, I am Elena Dominguez. I'm going to read some units. Let's start. Unit 24. Infections. Fever. A medical student has made some language notes on a class report. Case 45. A 24 years old man presented with a fever which he had had for 3 days. On the third day, he had had several attacks of fever with sweating and rigors. The only past history of relevance was hepatitis for 4 years earlier and glandular fever. At the age of 18, he had returned from Africa 3 weeks previously. Microorganisms. Infections differ from other diseases in a number of aspects. Most normally, they are caused by living microorganisms such as viruses or bacteria that can usually be identified thus established at the etiology early in the illness. Many of these organisms, including all bacteria, are sensitive to antibiotics, and most infections are potentially curable, unlike many non-infectious degenerative and chronic diseases. Communicability is another factor which differentiates infection from non-infectious disease. Transmission of pathogenic organisms to other people, differently or indirectly, may lead to an outbreak or epidemic. Finally, many infections are prevented by hygienic measures, by vaccines, or by drug prophylaxis. Microorganisms include bacteria, viruses, fungi, protozoa. Another general word for this pathogen is microbe. Patients often refer to microbes as germs or bugs. Notice the common expressions for treating an infection disease. Could we have cat picked up some disease from the dog? I think I caught the flu, but that's going wrong. Source and spread of infection. Here is an extract from a medical textbook. Infections might originate from the patient, usually from the skin, nasopharynx or bowel, or from outside source, often another person who may be either suffering from an infection or carrying a pathogenic microorganism. Carriers are usually healthy and may harbor the organism in their throat, bowel, or blood. Non-human sources of infections include water, milk, food, animal spirits, and also the stool. The incubation period is the period between the invasion of the tissue by pathogens and the appearance of clinical features of infection. The period of infectivity is the time that the patient is infectious to others. Match the two parts of the sentence. In 1988 saw the UK launch of Life Athenian. Number letter G. Measles, mumps, and rubella vaccine. Chickenpox is a common infection. Number E. Disease of childhood. Previous has an incubation. Number A. Period ranging from 4 days to many months. The patient remains febrile. Number letter H. With peaks of temperature of 39.5 Celsius. He has admitted with a 4-day history of influenza type, symptoms of fever with number letter B, rigors, myalgia, and general malaise. Quite a proportion of patients who recover from hepatitis B. Number C, become carriers of the virus. The central part of Africa is in the midst of an epidemic, letter F, of AIDS. Measles is most, letter D, infectious during the gestational stage. Lyme disease is caused by dissemination, letter G, of bee blood transferred from animals to men by exotic pigs. PUO stands for letter A, pyrexia of known origin. Complete the case report on the patient in A. On examination, he looked well. His pulse rate was 100 minutes. He had a palpable spleen, a combination of fever and rigor in a patient who has recently returned from Africa strongly suggests a diagnosis of malaria. The incubation period is usually 10 to 14 days. In this case, the patient admitted he had not been taking prophylaxis regularly. The diagnosis was confirmed by the presence of parasites in his blood film. Read the sentence. An infection which can be treated successfully with antibiotics is curable. Another word for an epidemic is an outbreak. Bacteria and viruses are examples of microorganisms. Someone whose temperature is normal is a febrile. The common infection with Epstein-Barr virus is known as glandular fever. Unit 25: Mental illness. Psychiatric disorders. Psychiatric disorders can be divided into organic and functional. Dementia is a mental disorder due to organic brain disease. The commonest form of dementia is that associated with old age. Senile dementia disorders in which there is no obvious pathology or anatomical change in organs are treatment functional. These are described below. Substance abuse. Abuse of a substance means using it in a way that is harmful. The commonest forms of substance abuse are alcoholism and drug abuse. Affective disorders. Here is an extract from a medical textbook. Affect and mood are similar in meaning and refer to the emotions. Affect tends to be used for temporary emotion and is expressed through the manner of speaking, facial expression, or behavior. Mood is used to refer to a more permanent emotional state. The most common form of affective disorder is depression. The symptoms are significant weight loss, sleep disturbance, fatigue, psychomotor agitation or psychomotor retardation, loss of interest in stimulating activities, decreased ability to think and concentrate, feeling that one is of no value to others or that one has done something wrong, recurrent thoughts of death or suicide. 5 or possibly 4 The above symptoms occur nearly every day for at least 2 weeks constitute a major depression. Neurotic and stress-related disorder. An example of neurotic disorder is abuse-compulsive disorder. An obsession is an idea that is so persistent that it interferes with the patient's life. A compulsion is an obsessive idea that forces the patient to act even though they recognize that it is unnecessary. A common form of this is compulsive washing of the hands, as stress is a feeling of being unable to cope. It can lead to anxiety or fear of problems. Attack of anxiety is called a panic attack. Other types of functional disorder. These include behavioral syndromes associated with psychological disturbance, disorders of adult personality and behavior, mental retardation, delayed mental development, schizophrenia, and other disorders in which there are delusions. Complete the table with words from A, C, and D and E. Noun, affect, adjective, affective. Noun, anxiety, anxious, behavior, behavioral, dementia, demented, disturbance, disturbed, suicide, suicidal. Make a word combination using a word from each box. Behavioral syndrome, eating disorder, major depression, mental retardation, personality disorder, psychomotor retardation, sleep, sleep disturbance, substance abuse. Complete the sentence. The way a person behaves is his or her behavior. A persistent emotional state is a mood. A sudden attack of anxiety is a panic attack. The form of dementia associated with age is called senile dementia, a disorder which is not associated with pathological change is functional. An idea which forces a patient to repeat unnecessary actions is a compulsion. Which symptoms of depression was this patient suffering from? A 50, 56 years old woman presented to her GP complaining of increased tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up earlier, but denied any suicidal tendencies. She was thirsty and was pacing urine more often. She was eating normally and her weight was stable. Unit 26. The nervous system. Sensory loss. The central nervous system controls the sensory and motor functions of the body. Disease of these systems therefore leads to loss of some of these functions. Hearing, deafness, buzzing or ringing in the ear. Sight, blindness, double vision, blurring. Sensation, numbness, tingling or pins and needles. Balance, unsteadiness, motor loss. Motor loss symptoms and signs include weakness, loss of power, paralysis, complete loss of power, tremor, involuntary rhythm, movement, especially of the hands, abnormal gait, unusual manner of walking. Speech may also be affected, for example, with hoarseness, rough, deep voice, as in vocal cord paralysis. Lyric speech means poor articulation, as in cerebral disease. Loss of consciousness. Patients might describe sudden loss of consciousness in a number of ways. I passed out. I had a blackout. I fainted. I had a fit. I had a seizure. I have a convulsion. Fit, seizure, and convulsion are all used to refer to violent, involuntary movements as in epilepsy. Doctors may say, when did you lose consciousness? Here is a passage from a textbook on the case of loss of consciousness. The principal differential diagnosis is between an epileptic fit and a syncopal attack, or fainting. Syncope is a sudden loss of consciousness due to temporary failure of the cerebral circulation. Syncope is distinguished from a seizure principle by the circumstance in which the event occurs. For example, syncope usually occurs when sustained under situations of severe stress, or in association with arrhythmia. Syncopal episodes are usually present by symptoms of dizziness and lightheadedness. In epilepsy, people may get a warning, known as an aura, that an attack is going to happen. Complete the table with words from A, B, and C. Blind, blindness; conscious, consciousness; deaf, deafness; dizzy, dizziness; numb, numbness; lightheaded, lightheadedness; unsteady, unsteadiness. Make word combination: double vision, epileptic fit, prodromal symptoms, psychope attack, urinary incontinence, and visual acuity. A doctor is trying to determine the cause of loss of consciousness in 5 to years old men. Did you lose consciousness suddenly or gradually? Did you get a warning of the attack? What were you doing before you passed it out? Were you worried or under any stress at the time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did your wife notice any involuntary movements while you were unconscious? Unit 27. The nervous systems 2. The motor system. Examination of the motor system should include assessment of the following: muscle bulk, look for signs of wasting; muscle tone, tone can be increased or decreased; muscle power, coordination, gait, reflex, involuntary movements, for example a tic or a tremor. Here is an extract from a case report about a patient with a tremor. On examination, her face showed little or no expression. There was tremor affecting mainly her right hand. She had general Increased muscle tone, power, reflex coordination, and sensation were within normal limits. Examination of her weight showed that she was slow to start walking and had difficulty stopping and turning. Tendon reflex. Examination of the nervous system normally includes testing the tendon reflex, for example, the knee jerk, with a tendon hammer. The reflex may be absent, diminished, normal, or bridge. The plantar reflex are also checked. The normal plantar response is a downgoing movement of the big toe, and an upgoing toe is abnormal. Coma. Coma is unconsciousness with a reduced response to external stimuli. Doctors say the patient is in coma or the patient is comatose. The Glasgow Coma Scale score is calculated as follows: eye open, spontaneous 4, to speech 3, to pain 2, none 1, verbal response oriented 5, confused 4, inappropriate 3, incomprehensible 2, none 1, motor response obey 6, localize 5, withdraw 4, flexion 3, extension 2, none 1. Complete the table with words from A and B. Absence, absent. Diminution, diminution. Flaccidity, flaccid. Spasticity, spastic. Wasting, waste. A doctor is giving instructions to a patient during an examination of the motor system. Identify what the doctor is assessing in each case. It's like you to realize I'm just going to move your arm up and down. Muscle tone. Can I see your hands? Muscle build and possibility involuntary movement. Now I'm going to straight your arm out. Try to stop me. Power. Can you touch my finger with yours and then touch your nose? Good. Now do it again with your eyes closed. Coordination. Complete the sentence. A facile hand drops limply to form a right angle with the wrist. A wrist reflex are reflexes that are stronger than normal. Muscle wasting means the muscle is reduced in bulk. A tic is a form of involuntary movement. A K is often used to test the plantar response. His coordination was poor; he could not perform rapid alternative movements. A reflex hammer is used to test reflex. When something is diminished, it is less than normal. A patient is brought to A&E in coma. When her name is spoken, she opens her eyes, but she does not answer questions or obey instructions. What is her GCS score? Is 5. At opponent and to speech is 3. Verbal response 0 is like 1. And moral response 0 is 1. The total is 5. Unit 28. Oncology. Neoplans. Neoplans is a normal new growth of tissue. Malignant neoplasm cancers are likely to spread and cause serious illness or death. Benign neoplasms do not spread and are less harmful. When speaking to patients, doctors generally say "lump or tumor". You have a small, raw tumor in the bowel. A lump or swelling is a collection of tissue or fluid which it is visible or palpable, can be palpated or felt with the fingers. A lump may be due to an neoplasm, but there are other causes such as inflammation or fluid accumulation. Patient said, "I have a lump in my left breast." Doctor said there was a firm palpable mass in the liver. Symptoms and signs of malignancy. The symptoms of malignant disease may be related to the size and location of the tumor. For example, a space-occupying lesion in the brain causes a rise in intracranial pressure and symptoms such as headache, vomiting, or visual disturbance. Tumors of the colon may obstruct the lumen and cause a change in bowel habits. Other possible symptoms of malignancy include bleeding, pain, and weight loss. A 33-year-old man presented to his GP complaining of a painless lump on the right side of his neck, which had been present for about 2 months and was enlarging. He had been feeling generally unwell and had lost about 5 kilos in weight. He was also complaining of night sweat. He had no significant past medical history. Treatment of tumors. A tumor can sometimes be completely removed or excised by surgery. If this is not possible, for example, if it has already metastasized to other parts of the body, it might be possible to destroy it by radiotherapy or by chemotherapy. When a cure is not possible, palliative treatment is given, which is only intended to relieve symptoms. Complete the table with words from A, B, and C. Cure, cure, curative. Excessive, excessive. Grow, growth, growing. Invade, invasion, invasive. Obstruct, obstruction, obstructive. Palliate, palliation, palliative. Palpate, palpation, palpable. Spread, spread, spreading. Swell, swelling, swelling, swollen. The notes below are about the patient described in B opposite. Examination of the central nervous system was normal. CNS health. His mouth and throat were normal. Autophagy NAD. Complete the sentence. Distant speed of tumor cells is known as metastasis. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. The opposite of painful is painless. A malignant neoplasm is called a cancer. Tumors which do not invade or metastasize are benign. Secondary tumors are those which result from the spread of a primary. If a cure is not possible, palliative treatment should be given. A palpable liver suggests metastasis. Unit 29: Pregnancy and childbirth. Childbirth, the expected date of delivery, is a date on which a woman is expected to give birth to the child she is carrying. It is calculated by adding 2,080 days or 40 weeks to the first day of the last menstrual period. Childbirth is also referred to by doctors as parturition. Delivery is the process of helping the child to be born. A full-term pregnancy is 40 weeks, divided into three trimesters. A baby who is born before this is premature, and one born after 40 weeks is postmature. A baby who is born dead, for example, because the umbilical cord is around its neck, is stillborn. A pregnancy may end before term spontaneous with a miscarriage or be deliberately terminated with an inclusive abortion. Labor: the process by which the fetus and placenta are pushed out of the uterus is called labor. It is divided into four stages. Some words which are combined with a labor are premature, prolonged, spontaneous, induced, and false labor. Presentation and lie. Fetal lie is the position of the fetus in the uterus. The normal lie is longitudinal and the abnormal lie is transverse. Fetal presentation refers to the part of the fetus which occupies the central of the pelvis canal and which the examination fingers falls on vagina. A baby that is born a week before the EDD is premature. A termination of pregnancy may be necessary for medical reasons. The first 3 months of pregnancy are known as the first trimester. Fetal distress in the first stage of labor is indication for cesarean section. It was breast presentation and delivery was by forceps. Miscarriage is another term for spontaneous labor abortion. The cord was wound tightly around the baby's neck and it was unfortunately stillborn. Abort. Complete the table with words from A. Abort, abortion, deliver, delivery, induce, induction, miscarry, miscarriage, present, presentation, terminate, termination. Unit 30. The respiratory system. South is a common symptom of upper respiratory tract infection and lung disease. A cause may be productive where the patient cough of sputum or non-productive. Where there is no sputum, a productive cough is often described as loose and a non-productive cough as dry. Sputum may be clear or white, yellow due to the presence of pus or blood stain. Auscultation. The doctor is examining Mr. Hamilton's chest. Take deep breaths in and out through your mouth. Good. Now, say 99. Listening to the chest with a stethoscope may reveal the presence of sounds apart of the normal breath sounds, crackles and whistles. The sound heard when the pleural surfaces are inflamed, as in pleurisy, is called pleural rub. The doctors asked Mr. Hamilton to say 99 to check vocal resonance which may be increased or decreased. After examination, Mr. Hammer took the doctor's add to his notes. Over chest, early inspiratory crackles, cold, long faces, broad expiratory whistle. Unit 31. The skin one. Sometimes of skin lesion. Macule spot. No rise above the surface of the skin. Papule spot. Rise above the surface of the skin. Nodule lump. A large papule. Vessel. A small blister filled with fluid. Bulla. Blister. A large vesicle. Pustule. Filled with pus. Cross. Scab. Derived blood. Psychiatry. Scar. A mark on the skin after healing. Nails. Birthmark. A colored skin lesion present at birth. Presley navel. Small. A rice brown navel. Verruga. Wart. Another produced by HPV. Furuncle. Boil. A large pustule or skin abscess. Trace, traces. A single skin lesion can be regular or irregular in shape. When there are many lesions, especially macules or papules, the result is a rash. For example, the rash of an infectious disease such as rubella, a rash is said to erupt or break out. My little boy has broken out in a spot in a rash all over his body. The following features of a skin lesion are usually noted: location, size, shape, color, and type. For a rash, note also distribution and grouping. Unit 32. The Skin 2. Injuries to the skin. Here is an extract for a medical website. Mechanical injuries to the skin are divided into those caused by a blunt force, such as a punch from a fist, and those caused by sharp force, such as a knife. Injuries from blunt force, an abrasion, a contusion, and a laceration. Injuries from sharp and incised wound, and the depth of a penetrating wound is greater than the superficial length of the wound. For example, a stab wound caused by a knife. A case report. An 8-year-old boy presented to the accident and emergency department after he stumbled and fell while running in a wood. He had received a blow to the head from a rock and had been scratched by bullets. On examination, there were a number of superficial scratches on the right side of his forehead. His right, his right upper lip was neatly contused. Sores. The word sore is a popular term for many different types of skin lesions, especially infected lesions. A pressure sore is a skin ulcer caused by pressure. For example, the pressure of lying in bed for a long period. A cold sore is a lesion caused by herpes simplex. Unit 2033. The urinary system. Urinary systems. Urine is formed in the kidneys and stored in the bladder until it is phased. Patient may say, I have some pain when I pass water or pee. Doctors may say, are you having any trouble with your water work? Urinalysis. Urinalysis is the analysis of urine. Simple screening tests of urine are carried out with cleaning strips. For example, cleanitis. Microscopic examination might reveal the presence of red blood cells, blue cells, or casts. Casts are solid bodies formed by proteins or cells. Like signs are used in case notes to indicate abnormal appearance. A small amount is described on a trace. For a large amount, the word "road" or "market" can be used. For example, gross hematuria when there is nothing. The word "nil" is common. There was no sugar, a trace of protein, and gross hematuria. And the last unit, Unit 34, basic is investigation, ophthalmoscopy. An ophthalmoscope allows the doctor to examine all parts of the eye, the iris, lens, retina, and optic disc. For a best result, examination is done with dimmed or lowered lights to allow the pupil to examine maximally dilate or widen. A topical mediated solution may be applied to the eye to aid dilatation. The patient is asked to fix it on the target for the duration of the test. Blood pressure. A sphygmomanometer, sphygmomanometer, gauge, cuff, fob, and value. A stethoscope, earpieces, headpieces, bell, and diaphragm. A stethoscope is used to hear the sound of blood rushing back throughout the artery. When the thumping sound is no longer heard, that's the diastolic blood pressure. Taking blood. During venipuncture, the phlebotomist, a technician who takes blood, inserts a needle into a vein and withdraws blood into a specimen tube. We sent to the hematology laboratory for analysis. Usually, the phlebotomist can find a vein in the inner part of the elbow. Afterwards, the patient may be asked to press light on a dressing, usually a piece of case, to help the blood to cut and to prevent swelling and hematoma where the vein was punctured. And the last exercise, a doctor is taken to a patient during an ophthalmoscopy. An examination is done with a dimmed light. Number 3. A topical mydriatic solution. Number 1. To aid dilatation. Number 2. Fixed on a target. Number 4. Complete the instruction. Wrap the cuff around the patient's upper arm. Place the diaphragm over the area of the brachial artery. Close the balloon on the lung. Pump up the pressure at the respiratory 50. Open the valve a little and slowly deflate the cuff while listening and watching the pressure gauge. The first sound you hear is the flow of pressure through the brachial artery. The value of the gauge at that point is the systolic blood pressure. Continue listening while you slowly dilate the cuff. The diastolic blood pressure is measured when the sound completely disappears. Complete the test. Physiotomists are especially trained in taking blood. They are skilled at vein puncturing the vein to take a blood sample. The wrist, hands, and foot can be used, but more often a vein in the inner part of the elbow is used. If it is difficult to localize twisted vein, the patient may be asked to make a fist or a tourniquet may be applied on the upper arm to make the vein more apparent.